In this video, we'll learn about goiter and how to examine if it is a goiter. Okay, goiter is an abnormal enlargement of a thyroid gland. Now, when there is an enlargement in the midline of your neck, it usually tells it's the thyroid gland, right? Now, the question is whether it happens in hypo or hyperthyroidism. Remember, both the cases can present with the swelling in the midline of neck. So, just the swelling is called as goiter. So, the goiter can be because of hypothyroidism or because of hyperthyroidism. Now, how do I find out if it's a thyroid swelling? Okay, first thing would be based on its location. It will be midline below the thyroid cartilage and it moves with the swallowing. Like, how do I test this? You ask the patient to drink water or just to swallow the saliva. If it's a thyroid swelling, no, the thyroid swelling will move up. Okay, so it moves up. If yes, if it moves up, then it's a thyroid swelling. Clear? Now we'll do another test on this patient. Now you ask the person to protrude the tongue out. Okay, just ask the person to just put his tongue out. Then if it's a thyroid swelling, no, remember, just by putting the tongue out, the thyroid swelling will not move. Why are we doing this tongue protrusion test? It is mainly to differentiate a thyroid swelling from a thyroglossal cyst. If it's a thyroglossal cyst, no, this cystic enlargement has happened because it's originating from a remnant of an embryonic during the whatever is left behind during the embryonic development, and it will be connected with the tongue. Okay, so if it's a thyroglossal cyst, remember when the person puts the tongue out, no, this swelling will move up, and also when the person swallows also the thyroglossal cyst also will move up. So now I'm doing this test to put the tongue out to distinguish this from thyroglossal cyst. Remember, both thyroglossal cyst as well as thyroid swelling both will move up during swallowing, but only the thyroglossal cyst will move with the tongue protrusion, but thyroid swelling will not move with the tongue protrusion. And will this thyroid swelling or goiter be tender? How do I know this is? Remember, most of these goiter patients, no, they'll have a very big enlargement. So that is a clear indication like it is mostly painless, because if it is painful, patient would have come to us earlier, right? So now what has happened? They are not approaching the doctors early because it's a painless swelling. Majority of the cases are painless unless the patient has some acute inflammation or infection, then only it becomes tender. And if you see the surface on palpation, diffuse goiter will be smooth, nodular, meaning in multinodular goiter, no, it will be like humpy bumpy appearance. That is the nodular feel. That's how you palpate for the surface. So in this video, we learned the difference between a goiter and thyroglossal cyst. Okay, we do two clinical tests. One is ask the person to swallow water. If in both the goiter as well as thyroglossal cyst, the swelling will move up. It's a midline swelling which moves up with swallowing. But when you put the tongue out, only the thyroglossal cyst will move up, but the thyroid swelling or goiter will not move up.